Hi, folks. A quick reminder that all sessions are recorded and being uploaded to the agenda page. So if you miss anything, it'll be there over the next few days. So at our last CB Insights conference, I completely biffed our moderator's intro. So let's see how I do this time. Our next speakers are Jennifer Schneider from Livongo and Ruth Reeder from Fast Company.
Nice. Great. So welcome, Jennifer. I'm excited for our conversation. So I just want to give a quick overview for anybody who's not familiar with Livongo Health. Livongo makes apps and devices for people who are managing chronic illness, think hypertension, diabetes. And the company takes a really holistic approach to what it does, thinking not only about the disease itself, but also social determinants, where people live, nutrition, co-occurring illnesses, depression, for example. And it's also been very good about integrating with other technologies, so a Fitbit, Apple Watch. So just so in case you haven't heard of it before, that's sort of what we're talking about today. And so Jennifer, the first thing I wanted to chat with you about, it's so present in our mind. We're all suffering through this pandemic. That's why we're on a Zoom right now and not in person. And so I wanted to ask you, because your population is one of the more at risk for COVID-19, what did you do when this outbreak struck? And also, can you just give the audience a little bit of a timeline for when you first acted?
Absolutely. So Ruth, thanks first and foremost for having me on. Delighted to have a conversation today. Vis-a-vis Zoom, with the social distancing, at least 6 feet apart. You're in New York and I'm in California. So when you think about the pandemic, when you look across the populations, we know that people living with chronic conditions, diabetes, cardiovascular disease, this is where we have solutions, are the population that have the highest mortality. They're no more likely to be infected, but when they are infected, we know that these are the at-risk the population. So CDC estimates that 78% of people in the intensive care unit have one or more underlying conditions. The solution that Livongo has built and developed for the past 6 years has been a solution that empowers people with those distinct conditions we're talking about, the at-risk populations, to be able to manage well in the presence of their home. So you can imagine that the pandemic has absolutely accelerated this business model. So this idea around virtual empowerment, remote monitoring for people living with chronic conditions has accelerated in the setting of COVID-19. The few things that we've done in addition to our existing solution is we have a behavioral health solution. We have had a behavioral health solution prior to the pandemic, but we built out a module specific to COVID-19. We know that many of us, I'll put myself included, I've got 3 small kids that I've been homeschooling whilst working and living in cramped quarters, right? There's the mental health strain on most Americans and most people worldwide is pretty exaggerated in this time period. Our coronavirus COVID-19 modules account for 2% of all the experiences you can have in the digital health, behavioral health solution, yet it accounts for 20% of our utilization to date. We've seen a 2-fold increase of the number of people who are tagging when they check their blood glucose, tagging that they feel stressed out. So that was the prompt to develop this solution for both our existing clients to take care of their members.
And so were you trying to help from a preventative perspective?
Well, it's from the mental health, absolutely, for sure. And so if you think about the reason we went into behavioral health, mental health prior to coronavirus is because for those of us living with chronic conditions, and I've had type 1 diabetes since I was 12, I'm 45, there's an additional component to life that's a burden. And those of us with chronic conditions have higher incidence of anxiety and depression. So the clear answer for the solution was there prior to the pandemic. The pandemic accelerated our utilization of that solution in the current environment.
Got it. And then do you have any insight in your population into how many people are getting COVID-19, or are you thinking about that and sort of thinking about maybe adding other modules that might help people who have either gotten it or are trying to prevent it, et cetera?
Yeah, so first of all, we have a data science team. I jokingly say our data science team rivals our engineering team, right? Because of what the core principles we're building is the ability to ingest data and drive, useful insights and deliver those back to people. And so currently in the setting, we're monitoring our population of people to see if their blood pressure, if their weight, if their blood glucose levels are accelerating, and then make some predictions around the overlay of where the coronavirus infections have hit to date. It's too early to share results with you, but I'd love to come back and share them when we have them. So we're starting to see that. In terms of additional modules, we have strong behavioral health support. And that's very important. I think probably the most important thing in this current phase of the pandemic. We're continuously looking at developing other modules for other chronic conditions, such as chronic kidney disease, congestive heart failure, for those populations whom are at risk, to keep them safe in their house so that we can provide the care that they need and deserve while being safe.
So Livongo has been really open to technological integration, and I'm really curious why. In part because you obviously have your own devices, you could easily have a closed system. So why play well with others?
So the vision and the mission of Livongo is to empower people with chronic conditions to live better and healthier lives. And in order to do that, we've inverted the healthcare spectrum, where we didn't design from the healthcare needs to the patient, from the doc to the patient. We flipped the paradigm and said, like other industries like Google and Amazon and Facebook, we said, let's design for the end user. What do they actually need and care about, and make their life simpler and easier and drive value to them? So part of doing that included integration with other partners in the ecosystem. So for example, we take data from continuous glucose monitors in addition to our own proprietary blood glucose finger stick meter, because a small percentage, but a number of our members use those continuous glucose monitors. We also integrate with smartwatches, Fitbit, Samsung, Alexa, HIPAA secure environment to deliver the information back to our members, because building a system and asking people to walk outside of how they already live their lives doesn't work for people. Building a solution that fits into the lives of the people living with the condition is how you deliver what we're really proud of, which is incredibly high net promoter scores, clinical outcomes, and cost savings to our client. So in order to do that, it's this flywheel of integration into the ecosystem. Think about Amazon. Amazon doesn't make all the things that I buy on it, but they've partnered with other people in the ecosystem to find and source what those are and then deliver them through their platform. Very similarly aligned in that we're meeting members where they are, adding our unique component, which is this data science on it, and delivering that information directly back to where people want it. We're not asking them to swerve out of their lane of life. We're meeting people where they are. And that has never been done in healthcare before. In healthcare, you're so often told to do something, to go do something, and it's pain, it's it's burden, and you just don't do it because it's like the pharmacy is not on your walk to work, right? So why would I do that? So it's creating a simple solution for our members.
Does that also have a benefit for Livongo from a data perspective? So do you get to learn new things about your patients as a result?
Absolutely. And our data ingestion is medical and non-medical. At the end of the day, we are changing people's behavior. So that includes medical information, biometric screening, health claims, pharmacy claims. But in order to be an effective behavior enabler, you have to truly understand people. Most people simply don't care only about their healthcare data. So as a doc, I would see people in the clinic and they'd come and say, if I were to say your LDL should be less than 100, okay, whatever. I don't know what that means. It's a number. But if I were to say, you should take your dog for a walk every evening, and that's the motivation that I'm giving somebody, they're more likely to do it because it's integrating this message directly into what matters for an individual. And so the science behind this is the data scientists with the clinicians, with the behavioral economists, developing messages around what is sustainable behavior and framing it in the way that you care about it, so you want to take action on it.
So this past quarter, Livongo reported that it had brought down losses. It was, I think the year before, it was 79 cents per share for losses, and then it came down to 6 cents per share. for the same quarter a year ago. And then Livongo also raised its full year guidance this year as well, or in the last earnings statement. So I'm curious, what's driving that growth?
So I take a step back and say, remote monitoring, our world of applied health signals, telehealth has all been in existence prior to the pandemic. And we were accelerating at a fairly good clip. The pandemic has pressed the gas pedal to the metal, if you will, and completely sped up the acceleration of this virtual care model. And it's done so because we're recognizing that twofold. One, vulnerable populations do better in their own environment if we can provide the right access. And second is that there's, it's not always healthy to go into the healthcare arena unless you need to be in the healthcare arena. And so if you look across what's happening, it's really been this realization that the value we provide is here to stay. We are delighting our members, our consumers, net promoter scores that rival those of other Silicon Valley companies such as Netflix, right? To think about healthcare being loved like Netflix is unheard of, right? That combined with clinical outcomes and cost savings has really accelerated our business model.
But you guys also have gotten a lot of new interest and also because of the pandemic. So can you talk a little bit about that and why the interest in you now? I mean, in some ways it's obvious, right? Because you're a digital health provider, but in other ways it's less obvious. I think that, telehealth, like a direct investment in telehealth, I can totally see why investors would do that, but why, or rather companies would be investing there, but why are companies turning to you?
So if you look across digital health, there's very few people who have documented value proposition. It's a great idea. It may be an okay or slightly better experience. I would think, there's some arguments that telehealth fits into that. We have, hundreds of clients whom have saved money. Right. So documented, peer reviewed, published, Milliman statistical leading actuaries who've defined that. And so if you think about the value proposition in a world where the economy is being hit hard, where there's a number of employee layoffs and furloughs, we're a company that's able to provide value into the healthcare ecosystem, an experience that people love, clinical outcomes, but hard dollar savings. So we're actually helping you manage your bottom line, independent of whether or not people love us, which they do, independent or not of improving clinical outcomes, which we also do. If you were just to look at the financial components, we're a good bet because we're providing those cost savings. That has not historically been true in the world of digital health writ large. That's a huge differentiator for us.
That's big. So there's a sense that Livongo is an overlooked stock, and I am curious why you think that is.
Yeah, so I think that I like to always say, growing up in the Midwest, my dad would always say, under promise and over deliver. Like the way to earn your stripes is to keep posting the score on the keeps posting the score on the board. And we're in a scenario where we're starting to do that. We've been publicly traded for nearly a year. We've been able to raise guidance every quarter. We've delivered and executed on our numbers. Again, I think the tailwinds of what's happening is a great business accelerator. The world of healthcare will not go back to where we were. It cannot go back right now. It cannot go back for the foreseeable future. And people will really start to understand it's a radically different experience. I did this the other day with my 7-year-old son. I had a telehealth provider visit with my in-town pediatrician for an ear infection. Right. And he sat on the couch reading a book, it was lovely. It took 15 minutes. I never had to get in the car. It was wonderful. So this experience coupled with outcomes is not going to change. And so we're really excited about the acceleration of the business right now.
That's great. I actually want to talk a little bit about the future of healthcare too, in as far as Livongo is concerned. So your company has already expanded into different categories, right? We were talking about diabetes, hypertension, behavioral health now. And I'm curious what other opportunities you see for expansion. Where do you really want to go next?
It's a really great question. So the other one I would add, so it's diabetes where we started. We then did hypertension, weight management, and diabetes prevention, which are two sides of the same coin, and then behavioral health. And our clients often ask us to go into a number of other areas because we've delivered effectively for them. If you think about where our core suite is, it's on 3 pillars. One is remote capture of data. All of our devices are cellular enabled. So think about rural places, tribal health. Think about when your Bluetooth breaks and you're too lazy to reconnect it, or it's kind of a pain. We never miss any of that data. The second is this data science that drives these unique personalized insights. And then the third is coupling that with an individual live person to deliver care when care is needed in a stepwise escalation fashion. So when you think about other conditions, things such as congestive heart failure, chronic kidney disease, where we sit in a world where our members also have those other conditions. And by taking care of what we describe as the whole person is the only way to drive value. You don't wake up every day and say, I'm going to go to my hypertension app, and today I'm going to go to my depression app. You just wake up and say, how can I be healthy? How can I be happy today? And so by putting those solutions on the same data platform and the same member experience, we can truly drive the outcomes. Members love it because we're telling them, hey, for you, this is what's most important today. And that allows us to drive incredible clinical outcomes and financial outcomes.
It's interesting. In our last conversation, you alluded to this just now. You've said that you want Livongo to stay focused on chronic health issues. And I think it's interesting because there's obviously the allure of tackling sort of more general, what you could call preventative health, but is really sort of more wellness, right? It's sort of helping healthy people stay healthier or be healthy and get healthier, right? And so I'm curious what keeps you from going down that route?
So I think about today, in our last earnings call, we announced that we have 328,000 people actively using our diabetes solution. That's an incredible growth trajectory for us. And today in the United States, there's 500,000 new diagnoses of diabetes per year. So we haven't even kept up with the inbound diagnoses. There's 34 million people living with diabetes. And so I think that, will we someday go into more wellness areas? Maybe, right? But today we're absolutely laser focused on the execution of this enormous problem that's ahead of us.
So, and more on that. So Livongo obviously is currently available through employer health programs. You also have health plans, and Medicare Advantage. Right, a person can't just download Livongo. So I have a kind of an accessy question, which is, I'm curious if you see an opportunity for Livongo in treating more under-resourced populations, because as you know, there's a huge risk for people who live in poverty, certain ethnic minorities of becoming diabetic or developing hypertension. These are some of the more at-risk populations, and they also have some of the worst access. So how do you bring what Livongo does to people like that?
It's a really wonderful question, and I'm going to tease it into a couple different responses. First and foremost, this idea around diversity and creating a solution that answers people's needs differently by ethnicity has been key to our founding, right? And I can give you some examples, but people in the South very rarely, identify with having diabetes. They identify with having a touch of the sugars, right? And so people, eat different types of carbohydrates depending on your ethnicity. Is it tortillas? Is it rice? Is it potatoes? And so truly customizing this individualization around the recommendations we're providing people has been core to what we've done. And so we have built a solution based off of a data platform that drives deep personalization. In terms of allowing increasing access, we've had some interesting penetration into Medicaid spaces, and we have some work ahead of us, but we're fully committed. Again, the mission of Livongo is to empower people with chronic conditions to live better and healthier lives. There's a number of ideas that we have, but the solution itself is built to do that in a hyper-personalized way.
That's really great. So looking ahead, I'm really curious, what do you see for the healthcare industry? We're in such an incredible moment right now. What do you think is going to be the focus for the industry at large in the months ahead?
Yeah, I wish I had a crystal ball and we could place bets on which horses are going to go where. I think the next 6 months are going to be fascinating, as I'm sure you have a similar sentiment. I do believe that this world of virtual care, of the true consumerism of healthcare, meeting people where they are, where they live their lives, purely driven out of necessity, because you can't go to the clinic, you can't go to the hospital unless you need to, is here to stay. Because I think people will quickly realize that it's really nice to have a conference in your bedroom, on your bed, in your pajamas, versus having to get in the car and go sit and read outdated magazines in your doctor's office, right? And I think we're going to see an interesting number of consolidations in the healthcare ecosystems, whether that's payers or PBMs or new digital health providers or pharma. And so it's, your guess is probably as good as mine as to which direction that will all go. But I do believe that we're in a period of time where value creation is increasingly important. For us at Livongo, we entered as a newer player in 2014, and a clear selling proposition for us has been the value creation in a very different way than existing incumbents have had to deliver, had to document. Not even clinical outcomes, but what about financial outcomes in a healthcare ecosystem where we know, right, that there's a tremendous amount of waste and a tremendous opportunity to therefore do a ton better. So I could not be more delighted to be in this ecosystem at this current point in time.
Yeah, I think just to follow up on that thing you were saying about consolidation, I think you and I were talking about in a past conversation that you think that there's going to be that more and more sort of like healthcare systems and also, healthcare providers are basically going to be looking for sort of single partners that can do a lot of things rather than sort of what we've seen in the past, or these tons and tons of startups. And so I'm curious why you think that is.
Well, I think that the idea around innovation is super appealing. And if you're actually somebody who's delivering care and making decisions, you want to have one throat to choke, so to speak, rather than multiple that you have to then keep tabs on. I think the second is, if you look at it from a member experience, and the reason we've been so persistent in a whole person experience is the way the healthcare ecosystem defines and segments the population. It's typically by condition, by expenditure. If you look at the roll-ups of how much do you spend in cardiovascular? How much do you spend in maternity? How much do you spend in diabetes? But the reality is that, 90% of the highest cost items, one of those people has one or more of the other conditions. And so if you develop solutions by condition, it's nearly impossible to actually truly treat that person optimally. So I think it's a twofold. I think purchasers in the ecosystem, it's like vendor fatigue, if you will. And I think the second is that there's growing awareness. If you're actually going to take care of somebody, I say this to my team all the time. If you're going to take care of somebody with diabetes, it's the ABCs. It's A1C, which is a measure for like blood glucose. It's blood pressure, and it's cholesterol, because almost nobody dies of blood glucose problems. They die as advanced cardiovascular disease. And so it's why cardiologists are now being trained in diabetes medications, right? It's this world of coming, rather than segregation by disease state or by disease system. We're really looking at the whole person.
Do you see any opportunities for health startups right now?
Yes, huge. I mean, this is like, if this is the place to be, right? I mean, the bad news and the good news, depending which side of the coin you're on, bad news is healthcare is broken. We've got a long way to go. Good news, there's super smart people out there with wonderful ideas that can truly be driven in a mission-directed orientation around making a difference. And people are looking for great solutions.
That's great. Well, that's excellent. Well, I want to thank you so much for joining me. This has been a really great conversation. And thanks, CV Insights, for hosting the both of us.
Thank you. Thanks, Ruth. Thanks, CV Insights. Wonderful to see you, and wonderful to be a part of this.